God's not ready for me yet.
No, you're still out there telling other people to have hope. And that's what you're here for. This is Anne Marie Hughes, and I am a 10-year survivor. And I am joined here today with Dr. Ira Sharp, who is also a fellow survivor. Good afternoon, Ira.
Good afternoon, Anne Marie. Thank you for asking me to speak today. Let me tell you my story. So my name is Ira Sharp, and I am a retired internist. I practiced medicine for 30 years, and I had pancreatic cancer. I was completely surprised and did not suspect that I would get cancer at all. But at age 57, I started to develop, first I developed diabetes, and I wasn't surprised because it runs in my family. And I was a little overweight. And then later on, I developed some abdominal digestive problems. And with the abdominal digestive problems, I was up all night. And I went to the emergency room, had a CAT scan, and had an ultrasound. And sure enough, I had pancreatic cancer and panicked. But I went to see a number of doctors who really helped me and gave me the mantra that I live with to this day, which is be positive, that there is hope. And when you're dealing with a diagnosis, the last thing that you want to hear your doctor say to you is, I'm sorry. But in fact, you have to stay positive. You have to do your homework. You have to get the help that you need, and you have to have the support and the backup of your friends and family, and as well as your healthcare team. And so I was extremely lucky. First of all, I'm lucky to live in a city which is blessed with lots of great medical centers, and I was able to get a number of medical opinions. And I was also extremely lucky to have a wonderful wife and son and daughter and my friends who all were there for me when I needed them. So I went through initially chemotherapy. I had what we call a locally advanced disease. I went through chemotherapy and then radiation therapy, a full 7 weeks. And after that, Dr. Yo, my surgeon, was able to operate on me. And at that point, we felt we got it all out. But pancreatic cancer, being what it is, came back 6 months later. And my cancer had spread to other parts of my body. And again, I was very lucky to find a number of excellent facilities and doctors in our area, and was able to start on a clinical trial. And for those of you who are undergoing pancreatic cancer treatment, please consider a clinical trial, because this disease is a terrible disease, and what we need is information to, at some point, develop a breakthrough. And that information and that breakthrough will come through clinical trials and research. And so I was very lucky to find an excellent physician who was conducting clinical trials in the Philadelphia area, Dr. Igor Sadarov at Fox Chase Medical Center, Cancer Center, and started on a clinical trial with a drug that, together with chemotherapy, put me in remission. That was back in 2015. And here I am today in 2021, almost 2022. And I am so very grateful to my doctors, nurses, care teams, and researchers who have made the kind of advances to help get to the point where we can look forward to the day when we will conquer this disease. And to pay it forward, to move forward, I myself am volunteering my time with PanCan, the Pancreatic Cancer Action Network, to help other people who are suffering from the disease or who have a family member who they're caring for. Because I really do think that reaching out to other people who are suffering and dealing with this is so very, very important. I know when I became sick, the first thing that I did was look for other survivors to give myself that sense of hope. I remember asking my gastroenterologist, I said, because I was only 57 years old, which I consider young. And I asked him, am I going to live? You know, am I going to live 5 years, 10 years? I could not envision myself dying. And he gave me some hope, and I looked and I reached out to PanCan and I reached out to other survivors. And those survivor stories that are listed on the PanCan website, my wife and I went through each and every one of them because that gave us something positive to look forward to and made us really feel good. So while you can't be unrealistic, it is a terrible, terrible disease. I don't think that there's any value to being hopeless. And even if you're suffering and even if you're not doing well, there's a lot that can be offered to you, both in terms of relief of symptoms and, God willing, one day, improvement in prognosis. And that's what I'm looking for, is for advances to be made. And we have to all together work on it. That's my feeling. You all have to work on it together to get to the point where we can achieve that breakthrough. I'm a little disappointed that there's not enough money being invested in pancreatic cancer. So any of you who are out there watching this, please write to your senators, your congressperson, and ask for more money to be invested in pancreatic cancer research, because that, in my opinion, is underfunded, totally underfunded, and it needs more resources so we can get to that time when we can look forward to a good prognosis. But stay positive, have hope. I think that's really important. I think once a diagnosis is made, try not to panic, but see a specialist who sees a lot of these kinds of cases. Try and get a second or even a third opinion. I think that's important. Learn as much as you can about the disease. Even if you're not a doctor, I think it's important to read up on it. And then consider a clinical trial, because you may be the breakthrough patient. I think that's really key. So that's my story, a little bit about my story. And I hope, I wish all of you well. And I wish PanCan lots of success in their effort to promote awareness of pancreatic cancer.
Thank you for helping to promote awareness. I think awareness, information, and advocacy and human will go a very, very long way.
I absolutely agree with that.